Hello, my lovely family. Guess what? I'm here for good. Let me tell you what implantation bleeding is, how to tell it apart from your regular menstrual period, when it happens, and what it looks like. Trust me, getting to know what implantation bleeding is would be a great piece of news for any woman trying to conceive because it is one of the sure signs of pregnancy. On the other hand, experiencing implantation bleeding wouldn't be a pleasant news to somebody who do not have any intentions of getting pregnant. Yet, I want you to know that it is not experienced by every pregnant woman and even could be a different thing to be experienced in each pregnancy because, mind you, every pregnancy is unique. And so, according to research, implantation bleeding is only experienced by 25 to 30% of pregnancies in women. First off, what is implantation? I want you to remember when we were talking about ovulation period, okay? So, when a woman releases an egg, this egg is supposed to be fertilized by the sperm of a man, which is known as fertilization. So after fertilization has taken place, it is said that this zygote that is formed as a result of the fertilization should move from the fertilization point or where fertilization took place to the uterus of the woman and then attaches itself by means of the zygote implanting or attaching itself to the walls of the woman's womb or her uterus is known as implantation. What then is implantation bleeding? Please, I want you to know that the walls of the uterus had delicate vessels. Okay, it is vascularized. And so, once the zygote gets there to implant itself, it has to puncture or distract some of these blood vessels. And then, once there's a break, obviously, blood will come out. Women experience implantation bleeding when these blood vessels oozes some form of blood and then it comes out from their vagina. Now, let's get right into the exact differences between implantation bleeding and the regular menstrual period. First of all, when does implantation bleeding take place? Okay, so it usually occurs between 6 and then 12 days after you've ovulated. So if you realize that maybe you've ovulated maybe today, and then after 6 and then 12 days, you've seen or you are seeing any form of spotting or any form of bleeding, it could be a sign of implantation bleeding. And normally your regular menstrual cycle could depend on your cycle length, which could be 25, 26, or any other length that you have. The second to talk about is the color. With reference to implantation bleeding, the color usually comes in pink or it looks like an old blood, whilst that of menstrual bleeding is usually bright red or it looks like a fresh blood. With the consistency, implantation bleeding is usually watery, okay? It doesn't have any form of clot in it. But then, menstrual cycle or menstrual bleeding could have clot or could come with clot, and it's usually heavy. With cramps, some women do not experience any form of pain at all when they are having implantation bleeding. On the other hand, menstrual cycle or menstrual bleeding could come with severe or moderate cramps that women experience. Also, get to know that with the flow of implantation bleeding, it doesn't or cannot feel a pad or a tampon, okay? So usually, women maybe perhaps go to the washroom and then whilst they wipe with a tissue, they find some form of or some trickle of blood on the tissue. But with that of menstrual bleeding, that should be able to fill a pad or a tampon. Now, let's talk about the results. So with implantation bleeding, as I said from the beginning of this video, it is a good news for pregnancy because it is a sure sign of pregnancy, whilst menstrual bleeding doesn't depict or doesn't result in any pregnancy. So family, I want you to know that implantation bleeding is a normal thing to experience. And as I said, it's a sure way to tell if you are pregnant or not. But then I would want you to wait until a day or two after you miss your period. Then you go to the hospital to check if truly you are pregnant or not. But then just know that it is normal, it is not miscarriage, it doesn't need any treatment, it is harmless, and it's a good news because it can tell that you are pregnant or not. Thank you and hope to see you in my next video. Bye bye.